Hey everyone, and welcome to our Zone 1 podcast. It's lovely to be with you. It's been a while since we've had our last one. And for those of you that don't know, this podcast is where we talk all things be activated. So I always like to start with just giving a quick summary of what be activated is for me. And there's many different definitions around the world, but be activated is a evaluation and treatment approach that was designed by Douglas Hill. And with Be Activated, we identify faulty breathing and movement patterns that are typically underlying to causing overload, pain, injury, and poor performance. Now, if we are able to correctly identify these patterns and correct them, then we are able to get to the root cause of the problem and make more of a long-term difference with our clients. And the interesting thing with this work is once we restore normal breathing, once we restore normal movement sequence, it has an amazing impact on our nervous system and on our mental state. So we're definitely working with the body from a physical perspective, but it has a massive impact on what happens with people mentally and on their mental capacity and also the mental performance. So that's a quick summary of what it's all about. But let's just touch on what's happening in the next couple of months, all right, without getting into too much details. The diary coming up between me and Douglas. Doug, I know, is heading off to the US again soon, and he's also going to be doing some teaching in Canada for the first time in a long time in Montreal. All of those workshops are available on Douglas's website. From my side, we're going to have a fundamentals workshop in Melbourne, and the date for that is going to be 29 August to the 1st of September. This is an initial workshop for anyone starting with the work and for anyone wanting to reinforce all of the basic principles of Be Activated. And then very excited for South Africa. We're going to be having our first advanced workshop in South Africa. That's coming up a bit later in September, from the 10th to the 13th of September. Now, these two workshops, the Fundamentals Melbourne, the Advanced for South Africa, are all available through my website. And there'll be a link along with this podcast for you to go and have a look at or reach out if you've got any questions. And then there's more plans for later in the year. Some details about that will come out still, but there will be more teaching in the UK. There'll be more teaching in Denmark. And looking forward to myself doing some traveling and assisting on those workshops moving forward. So, our guest today, and I want to welcome Dr. Andy Gordon, who's a highly experienced osteopath and working on the Gold Coast. I believe, Andy, it looks a lot warmer there just from looking at your dress than what it is here. Winter set in here in Melbourne, but welcome, Andy. Nice to have you here.
Thank you. It's nice to meet you again or chat again. It is a sunny day today, which is good. So plenty of rain, but it's good to be chatting again.
Awesome, Andy. Now, maybe just give the listeners just a little bit of background about who are you, Andy? What is it that you do, and how long have you sort of been in your field as an osteopath?
So I'm a practicing osteopath on the Gold Coast. I've been practicing for nearly 28 years now. Before that, I was a massage therapist and personal trainer, so always working with my hands and working manually with patients. And that sort of brought me through to the Be Activated and Douglas's approach to manual therapy, and yeah, basically how we use the protocol.
Amazing. Well, we'll get into all of that shortly. Something that I always remember that from some of the first workshops that you joined me on, you told me that you always found a lot of correlation between Be Activated and the original osteopathic principles, and therefore you felt it really ties in nicely with what you guys do. So it made me think, and before we jumped on, I did a few searches as we do these days, and I saw what AI had to say about osteopathy and what would be the AI summary of it. And you can correct me if this is wrong, but what we found was AI says osteopathy is a holistic, non-invasive, manual healthcare practice that focuses on treating the body's neuromusculoskeletal system. It aims to improve overall mobility, relieve pain, and support the body's natural healing capacity through hands-on physical manipulation. So I guess how does that land with you, Andy? For me, there's a few things that jumps out there, but how does that land with you, and how have you found Be Activated fit into your world as an osteopath?
So yeah, so nowadays osteopathy is more musculoskeletal, neuromusculoskeletal. Originally, the original osteopath AT still was a doctor back in the 1800s. So he dealt with disease. We've actually moved away from that, and we now just work in the musculoskeletal framework. Um, the description was accurate, but osteopathy is also based on a set principles. So the principle being that the body is a unit. So therefore, it's the body, mind, and spirit, which we encompass a fair bit in the Be Activated. How the way we think can affect our body, and the way it either implodes on itself or expands. So therefore, again, the principles are the same. Even though Douglas doesn't structurally go through the principles, he talks about the principles of Be Activated within what he teaches.
Yeah, and I guess, for me, if we talk about principles, what we're really talking about is the body's principles, and I think
Yes.
that's the correlation. Is when we work with the body, our body is very much about what happens in our mind, about our mental side, and what happens in our physiology. And on the workshops, we really try and take therapists through the experience of seeing how very directly what we put in our heads affects how our body responds physically. And there's physical changes that are very measurable when our body goes into certain mental states like fight or flight. And likewise, if our physiology is stuck in a certain place and our body is moving or breathing in a certain way, it very much affects how we feel. And it changes the
Mm,
whole world. And if we want to be successful with our clients or more successful with our clients, it's important to always consider both of these, I guess, two sides of how the body functions. Yeah,
mm. And one of the exercises that Doug uses is by changing your posture and slouching and slumping, how it can make you feel different and make you feel heavy and depressed. So it works both ways as far as the structure having an integration into the mind, and the mind having a change on the structure and how we either perform or just move.
yeah. And with this work, we try to combine it. I think there's a lot of professions that work with the body physically, and there's a lot of professions again that work with the body from a mental point of view. But the real magic happens when we can combine these two, when we can help to unlock someone physically and at the same time discuss maybe the mental aspects that's going on in their life. And I find that's where the real big shifts and the real magic with work happens.
Mm.
Tell me, Andy, when you brought this work into your osteopathy practice, you know, I always find therapists, one of their concerns is, look, well, they say my clients expect to have a typical osteopathy treatment or whatever the field is they work in. They're expecting us to do physiotherapy with them. They're expecting us to do a massage. And then we bring this different approach, and people always find that a bit of a hurdle. And how have you found bringing this work into your sessions with your clients, and how have you found your clients have responded to that?
So I was having this discussion today with one of the osteopaths I work with, and his thing was, how do you, because the Be Activated is a sequence of uh, working through the body, how do you then just use part of it? Um, but again, it goes back to the very basic principles, and Doug just recently put a webcast out about it. The principles are that we need to breathe and move. So the first thing I do is the diaphragm work. So even if you don't move past that with some patients, just by getting them to breathe effectively and to drop into more of a parasympathetic state, you've already started that change.
Yeah.
What I do find is that, because I only do 30-minute treatments with most patients, even if I do zone one, I do it with meaning and with focus to actually get them to drop into that parasympathetic state. That in itself sells itself. They then want to know, what else can I do?
Yeah.
Because when they stand, they feel lighter, they feel taller, they feel different. So you don't really have to sell the treatment. It sells itself. but it's based on feeling it.
Yeah.
You can describe it and you can tell people yourself, you can tell people all day long, but until they feel the changes in their body, it's something that they just can't understand until you feel it. It's very different. It's very,
And I love that you say that, because that is what when I teach and I explain this to therapists, it's the words that I use as well, is that you don't have to sell this work, but you do have to expose your clients to this work. And if you
yes.
do, it sells itself. And the reason is exactly what you've explained to us so beautifully there, is that people feel the change in their body immediately. And then it's easy. We don't have to do convincing. When people immediately feel that has changed something, either in how they feel mentally or how they feel physically, the rest comes easy. And then one can add further complexity and further treatment to that, because then we have our client on board. The other thing that
Mm,
I liked that you said was, when we do the basics, we start shifting someone's, because essentially, for the listeners that are not familiar with this work, is when our nervous system is in overwhelm, on fight to flight, we tend to be breathing and moving in certain compensation strategies. So if we start unlocking that by, for instance, helping someone to breathe more correctly, there's an immediate shift in the nervous system and a lowering in the state of the nervous system, which for me brings them into the room. And suddenly
mm,
they're aware. Suddenly they're in their body a little bit more and feeling what you're doing with them, which is why the initial work is so important. And it's also why we start there, because this is how the body works. If we can shift someone's breathing, we first have to get them breathing more correctly, and then we have to get them moving correctly around their hips and their pelvis, and that's what we refer to as zone one, that Annie mentioned. And for me, well, not for me, in this work, that is the essence of this work, is if we can get people to breathe and initiate movement correctly, then the rest of the compensations already start changing and normalizing. So even if we
mm,
just do that, that has a massive impact on correcting things, which sounds like what you do with a lot of your clients.
mm. So it took me a little while to really uh, drop back to understand that. Everyone I hear Doug all the time, people say to him, "What else is there? What more is there? What's when we?" But and he kept bringing it back to the zone one,
Yeah.
and now even with his advanced course, it's very much centered back around zone one and how, and that to me brought that back into how important zone one is and
It-
the breath and the
yeah.
movement side.
It's really the work. The work is, we move with faulty patterns. But I always explain to clients the reason why we move with a faulty pattern. And a faulty pattern might be we initiate movement, let's say, in the upper body. Now,
Mm,
that faulty pattern is there because that person does not have correct movement sequence. They're unable to move and initiate movement correctly from zone one, from the diaphragm, from the psoas and the glutes around your hips. And therefore, in order to restore whatever compensation patterns they have, we need to always restore zone one first. And that's the essence of the work. Once we've restored zone
mm,
one, they don't need to go into their faulty patterns. And that then affects their problem. And if their problem is a headache because that's how they move, then it will already start affecting that. And if their problem was spraining their ankle repetitively because their compensation is a lower leg pattern, it also starts addressing that. But it
mm.
always comes back to zone one. And that's
Yeah,
that's what you've obviously and learned after working with the work for a bit. And it was the same for me. I remember when I started, there's sometimes suddenly a penny drops and one realizes, well, if that's the case, it means every one of your clients needs this, because
yes,
it's applicable to everyone. And that for
yes.
me was quite a light bulb moment many, many years ago, when I was like you, just starting to originally play with this work. And I only
Mm,
initially used it with some clients. I picked suitable ones, like a lot of people do when they start doing our works.
yeah,
But at some point, the penny drops and you realize, well, this is not just for some clients.
no,
It is for all of our clients, because it really comes down to the same thing always. They just
yeah.
present
Priorities
different
are
problems
right.
because of it, but it's the same thing.
Mm. So people often, you say to them, you're not breathing efficiently, and they say, "But I'm breathing. How am?" And I say, "Well, it is the most essential thing of life. It's the first thing we do when we're born. It's the last thing we do when we die. Breathing is really important. If you don't breathe using your diaphragm, you will do something else to be able to breathe. And that generally is using their neck muscles, their scalenes, their intercostals.
And if
Um,
we if we use that simple logic, Andy, then why is breathing not part of every single therapy that is done, every single exercise session that is done? In my opinion, if we're not correcting someone's breathing along with that, we're missing a massive portion of how our body functions. And
yeah. And this is what I tell people when they start any type of exercise program. You have to build a foundation. And the foundation is built around, like we said, the breathing correctly and then moving. Within some spheres, that they're starting to do more breathing workshops.
yeah,
But I still find that people don't quite understand the full diaphragmatic breath. And
yeah,
that's something that Doug really sort of emphasizes is
yeah.
finding the correct pattern or sequence to actually get the person to drop into that breath.
I think that for me, the important thing there is there's definitely much more of awareness now of breathing. There's, breath work classes. It's definitely becoming quite a popular thing these days. But
Yes. Mm,
where we go wrong is, and well, I wouldn't say wrong, where it's maybe not as effective is if we're just trying to teach someone to breathe correctly, but their body has got physical limitations. Now, what happens with these faulty patterns, if we breathe, let's say apically up here for long enough, your body adapts and all sorts of things
mm,
shorten and tighten to allow for us to breathe apically easier so that we can
yes.
survive. But
Mm,
but that person, if we now try and get them to breathe diaphragmatically, they struggle because their body
mm,
is has adapted to breathing apically. So just teaching someone is limited, which is why
mm,
a lot of people don't get it right. So that's where this work comes in. We first have to prepare the body in order to breathe correctly, meaning we have to remove those restrictions that
mm,
limits them to breathe correctly with the diaphragm. And the beauty is once you do that, and again, this ties in with that definition we gave about osteopathy before, is then the body's got this beautiful ability to adjust and almost correct on its own. Yes, we
mm,
also then teach clients how to breathe diaphragmatically, but Annie, you would have seen, and everyone else has been on our workshops, once you restore that balance in the body, you'll see someone just instantly takes a diaphragmatic breath. Because our body
mm,
knows how to do it. We just need
yeah.
to take away the restrictions
Mm.
that makes it hard to do it. And then, yes, we reinforce it. But I think that's the key element that is missing with just practicing breath work.
Because that's the other thing you were saying before about with different therapies. Most people do not touch the thoracic area or the diaphragm. Everything's centered around releasing the back and the neck and the arms. And so when you first touch someone's sternum, they can't believe how painful it is because it's never been touched before. But it's so glued down that the fascia is not able to expand. So just trying to get them to use the diaphragm when the fascia is so locked in,
Yeah,
it's still restricted and stays within that sort of protective pattern.
yeah,
So that's why the manual side of the therapy is so important. One, it's to bring their attention to where the tissues are glued down, but two, to actually release it for them to actually be able to use the diaphragm.
yeah. And it ties in with we've got onto the track to talk about breathing, and that's good because the breathing is so important. I think it's often overseen, even for people that have done our workshops. Forget the breathing is essential to maintain the changes we get, to give them more long-standing difference. The breathing is vital for many reasons. But just like we've discussed with breathing, maybe we can if we went over to movement, it's the same with movement. Now in my field, I'm originally a physiotherapist, and physiotherapy has changed to where physios here in Australia hardly work with their hands. They prescribe exercise, they do rehab, they do, and the problem is that we can't just train people out of these compensation patterns. Just like I explained earlier, when we move incorrectly with an incorrect sequence, your body adapts and tissue shorten and tighten to allow for that to happen. And then your brain starts using different neural pathways, using different muscle slings to just do normal movement every day. So it doesn't mean the exercise isn't important, but there's something else that has to come in between. Just like with the breathing, we need to first prepare the body so that the body can move correctly, and then we need to move. And that's where the magic happens. So Activations is all about restoring the correct neural pathways between your brain and the right muscle slings by removing the restrictions that is limiting your nervous system. And once we do that, and then we reinforce it with movement and with rehab and with exercises, then suddenly there's this whole different level of success that we can get with our clients. And it doesn't take away from, you know, the fact that exercise has value, the fact that breathwork classes has value, the fact that many of the modalities we use have value. But if we don't address that cause from the start, then I find we don't get as much longevity with the results with our clients.
Mm. I had a patient the other day where she's been doing glute bridges with a band around her knees. So when she goes to lift the hips, her knees drop in. So the physio or an exercise physiologist put the band around the knees. But each time she come up, it would want to go in first. So it didn't really change her pattern. When I then treated her lats and her piriformis, she then automatically the thighs would externally rotate on hip thrust rather than want to drop in. So, even just with exercise, trying to use different equipment, it doesn't change that pattern if the brain has no access to those muscles.
Yeah, I see that over and over again with clients with, let's just take a ACL rupture. And as physios, we end up seeing those clients quite often post-operatively for rehab. And if you go and test them, so for those of you that are not aware, but there's certain patterns when we identify specific patterns in the body of how people initiate movement. And each pattern has got very distinctive injury profiles that's typically linked to those patterns in clients. Therefore, we can predict the risk for certain injuries in certain clients if we can measure their patterns. So with ACLs, the typical pattern that leads to ACL ruptures, particularly non-traumatic ACLs, is a pattern we call a 2-2-3 pattern. Now, don't let that confuse you too much, listeners, if you don't know what the numbers are. But it just means they initiate their movement in a way that puts them at risk for instability in the knee and therefore ACL ruptures. And if I test those clients, and it doesn't matter how many we've done over the years, even post surgery, a lot of them post rehab, which maybe had not an ideal result. If we then still test them, they still fire exactly the same pattern that they fired, which was the pattern that originally caused that injury. And if you've seen it, and again, it's one of those things that you can tell people this, but you have to actually get in your clinic and start testing patterns with each of your clients. For me, it was like that. And once you've seen it enough, you realize, well, the pattern always links to the injury. And if you see that, then we realize, well, that means we always have to address the pattern. And if we don't, then we end up rehabbing them in their compensation pattern. So they then get stronger. Let's take the ACL. We build that quad up so big that that quad can now handle the overload of the compensation they are still using. But we still actually haven't fixed the problem. They still fire the same compensation strategy where if we approach it differently, then do the rehab. Like your client, if you correct their pattern, you get their zone one kicking in, you go and get that lateral control and the oblique slings in, then suddenly they can hold steady on the hips. If we were now to do a glute exercise, now we're going to get the glutes and we're going to get proper results and we're going to build the glutes. But up until then, all they were doing is using the old compensation. And whatever that was, we were building that and not their glutes. So yeah.
Yeah. It's the same thing. I see a lot with hamstring injuries, the same thing, where they've had a hamstring injury, they've done all the rehab, but as soon as they actually go back to putting it under load, they strain their hamstrings. And that's what a lot of the older athletes, sort of coming towards the end of the career, what stops their careers is the recurrent injuries that just don't go away.
Yeah.
And so many patients, when I actually address this with them, they then say, "Oh, I wish I would have known this 10 years ago, and then I wouldn't have had to retire."
Yeah, I've heard that from many, many athletes over the years. Why didn't you tell me this 20 years ago? And
Yeah.
reality is we didn't understand all of it, and we still understand only part of it. But it's amazing that the more we, I guess, get into this work, the more we actually start understanding what we do. Years ago, activations was just a few cool techniques that seemed to work, but we really didn't understand half of why we were doing it. Now, these days, the philosophy has developed enough that we have a lot more understanding as to why it's working. And we see amazing results, which is the example that you use there with the hamstrings is something we see all the time, and hamstrings are commonly those hamstring strains are because of their glutes not engaging effectively, and then the hamstrings have to take over the glutes function. Now, as I say, there's some of you out there might think, yeah, we've been knowing this forever as physios,
Mm,
as chiros, as osteos, and we have. But it's the way we've tried to correct it that's the problem. So now, what in the past, what we would do is, well, we just give them glute exercises, and they're bridging, like you just
mm,
said, and they
yeah.
hinging, and they're doing all sorts of weird and wonderful glute stuff. But those clients, all they're doing there is they're still using their hamstrings and their lumbar
Mm,
extensor to do the gluteus job. And when we get that hammy strong enough, eventually it overcomes the injury because we've beefed it up so much it can now handle a bit better this heavy task we've given it to do the gluteus work. But we haven't actually fixed the problem. And that's where I
no.
think the problem lies. And if we approach it differently, then do the rehab, the results are just much better.
Mhm.
And you've touched on sport, so I wanted to get to that. And I know yourself, you're an avid athlete, and also I know that your wife is a high level athlete. Maybe just give us a bit of insight. What has your experience been with seeing using activations in sport? What are the results that you've seen as far as injury prevention, as far as performance goes?
Yeah, I've worked with a few different performers, not just athletes, but actually circus performers. And the same thing, they don't necessarily have the best patterns, but they have the best compensations
Yeah,
until they don't. So therefore, once you address these compensations, you can see they move differently. Um, they're able to have a bit more rotation or a bit more flexibility through the spine, um, through the shoulder girdle, and the hamstrings. A passive straight leg raise. They'll go from anything from 45 degrees, and they can go, depending on the type of athlete, right up to 140 degrees. So, yeah, the athletes can't believe the difference in their actual change uh, because they know their bodies. They know they don't know their compensation patterns, but they know something's not right. And they know, and as soon as you change it, they can feel that change. The general population can feel something, but an athlete really knows their body. They'll the thing with an athlete though is as soon as you fix one thing, they go harder. So it doesn't necessarily mean they don't break down, but they handle more load before they break down.
yeah,
But an athlete is what an athlete is, and always pushing for more.
yeah. And that's the thing. If we moving with those compensation patterns, and particularly for athletes that reinforce it so much with all the training they do, they get stronger and we see results. But if we can correct their pattern, there's a huge performance aspect that comes into that. And we can generally very measurably improve their performance if we get them putting all that time and effort in, but now putting it in the right sequence and in the right pattern. Then we get
Mm.
better results. And the flip side of that is much less overload, less injury. And as you said, it will take a lot more loading before the breakdown will happen. But with that, there's a big opportunity for more performance. And
They've generally performed higher. I
yeah,
mean, it won't take an average athlete and make them a high level gold medal winner, but it will make them a better version of them.
yeah, well, that's it. I guess that, yeah, and that's a good point. I mean, I've this work is sometimes a bit like magic and we can see amazing results, but it doesn't mean we can generate, as you say, talent from someone that only has that amount of capability. But I guess the point of this work, and this is for me on all levels, on a physical level, on a sports level, on a mental level, is when we correct and restore balance in the body as far as breathing goes, as far as movement goes, it gives that individual the capacity to be the best of their ability. And
Mm.
that's really what we want. And if that is, winning their high school 100-meter race at their local school event, or if that is competing at the Olympic Games, I mean, that's really what we're looking to do. We want to be the best of what we're able to do in whatever we
Mm.
do. And I
Yeah.
work with athletes, but on the other side of it, I work with vocalists. You work with circus artists. And I just today had a presentation for a whole group of high level CEOs here in Melbourne because in the end, it's all the same for me.
Yes.
It's about
Mm.
giving
They're
our
their
body the
performance in their
yeah,
field.
if we get your body to function in its optimal way, physically and mentally, it makes you better at your game, whatever your game is. If your game is performing in the boardroom, then that's what we're doing. And if your game is performing circus acts, then that's where we see the difference. And which is why in the end this work becomes applicable to almost any of the clients that walk through your door.
Mm. Back to the athlete side of things, when we talked about a little bit before about the nervous system. Some athletes do well, but as soon as the stress increases, they shut down. So by giving them more capacity, by allowing their body to function, or to give them, so I give them breathing exercises. So some of them were ballroom dancers, and they found that once they got to the finals, they would really struggle and things would start to break down. So by getting them to do some breathing exercises between their rounds, it was able to drop their arousal a little bit so that they could actually cope with the distance of the competition that they were doing.
As soon as our body is under threat, as soon as we're stressing or getting anxious, and if it could be about a race, it could be about a business meeting, it could be whatever it could be because of your difficult partner at home, whatever the triggers are. But as soon as our nervous system it pushes us into our compensation pattern. And
Mm.
as soon as that happens, then we break down and then we're
Yeah,
unable to perform as well. So a big part of the work is just what you said, there's building capacity. So
resilient.
yeah, if someone's nervous system is always running up here and their ceiling is somewhere there, then there's not a lot of space or wriggle room. And so as soon as something triggers them, they're instantly in the cheat pattern. But what we do with this work is once we get someone breathing more correctly, once we get them moving in a more normal sequence, their nervous system drops to, let's say, somewhere there. And now suddenly triggers has less of an impact. And as you said, they have suddenly have that resilience to handle a lot more of that pressure before they go into a full cheat pattern. And
Mm.
then again, that's what we want to train. And it doesn't mean everyone we work with never shoots into fight or flight again, but
Yeah.
we want them to be able to recognize when that happens, then have some tools to pull them back from there,
Yes.
and have some tools to help us. We want more days and more times where they're firing a better pattern. And if we can get that, then that instantly gives us better results and less injuries.
Plus, with the athletes, the adaptation is during the recovery phase. It's not during the sympathetic phase. So if you can drop them into the parasympathetic phase and give them a tool to do that, their body will recover ready for the next session better, rather than them already be quite wound up, or that the tissues haven't remodeled correctly, which then they come through injuries. So by teaching them to drop into and teaching them that that's what happens with their bodies, that it's a normal thing to go into sympathetic arousal to train. But if you don't drop into the parasympathetic, you won't recover ready for that next session.
I always say it's about choice. So,
Mm.
so yes, sometimes the athlete needs to be heightened to perform at their best for certain periods of the game or certain, but you can only fully fire that up if we have capacity to do that. So if we're always living in a heightened state, we're training in a heightened state, we're living in a heightened state, and now we want to push ourselves more, our ability to do that is much less. So it's all about choice. We want an athlete to come from calm and then fire themselves up in order to perform. And as you
Mm.
correctly said, then return to the calm quicker. The quicker we can get back there, the quicker we can recover, which is why the standard thing I would teach athletes is activation before training and competing. But for the ones that take enough of it on board, the next step is definitely activation after. The quicker we
Yeah.
can recover, the quicker we can bring breathing into our training sessions, in between each repetition. When we're resting, we come back to correct breathing because that immediately settles the nervous system. We recover faster, and then we can perform quicker again. And the same
Mm.
principle overnight or in the week off between big events. The quicker we can get back to a parasympathetic state, the quicker we recover and the better our ability then to perform the next time.
Mm.
Andy, let's talk a little bit about just something that was mentioned in the osteopathy definition is neuromuscular control. And
Mm.
maybe something I want to touch on because it's often misunderstood. When you see this work for the first time, we go and we release, let's say, tissue behind the back of the head. And
Mhm.
suddenly, this guy's glutes kick in. And you all
mm,
see it on a workshop, and it is amazing. And he could only hold maybe a 1 out of 10, and suddenly he can hold an 8 out of 10. And all we've done is rub on the back of his head. And honestly, the
mm,
first time you see it, you think, what, for me anyway, you think, what the hell? This is impossible. How does this
mm,
work? Is this magic or is it put on? Or is it make believe?
mm,
And for me, the answer, and honestly, I thought that I've told the story many times, but the first time I did a workshop, I couldn't wrap my head around it. I'm like, this is impossible. It makes no sense with what I was trained as a physiotherapist. However, yeah, I see it happening and I'm feeling it in my own body, but I had this conflict actually for years, which is really what brought me to teaching, is that I'm helping people get there a little bit quicker. But
mm.
the penny dropped for me is the understanding it's the neuromuscular control that we trained
Yes.
in.
So the way I explain it is the same as a light circuit. We can see the light bulb, we can see the switch, we can't see the cables between. If
Yeah.
you come from living in the jungle or somewhere where they've never had electricity and you switch the light switch on and the light comes on, you go, you must be a god because you've changed, but all you've done is you've switched the circuit to allow the electricity to flow through. So I used to be an electrician many years ago. So the nerve pathways in the
That,
body is something that I was always interested in.
yeah.
So if you decrease neural compression, and most of the neural compression we work with are not peripheral nerves, they're superficial nerves. And they're finding more and more that the superficial nerves are actually the acupuncture points that they're popping needles in. And it's where the nerves either bifurcate or separate off that get caught within the fascia. And what we're doing is we're releasing the fascia to allow it to glide. If you were to actually look under ultrasound, you'd see that the tissues were actually stuck and there was no movement. They're not gliding. A healthy tissue, you can see that the actual tissues glide over each other. So if you can imagine they get stuck and they impinge those nerves, you're losing strength because you're losing the ability for the fascia to expand. So you know that when the muscle contracts, it gets thicker, but it can only get thicker if the fascia allows it to move. If it's stuck down, it
Yeah.
can't move. So therefore we're re-educating to allow for the flow through there. And sometimes it is the peripheral nerves that we're working with, especially if we're working along the spine. But sometimes it's more these superficial nerves. And that's something that, again, with science, we're starting to understand more. And I explain to people that I can explain everything I do with science, so therefore it's not magic.
Yeah.
And,
There's
and that's how I
not,
sort of,
I, I can tell you the magic, there is magic, but the magic is the magic of the body, is the
yes.
fact that our body can do incredible things if
Mm,
we just help remove some of the limitations that's stopping it from correcting itself. And for me,
mm,
that's really what you've explained there is definitely a big part of it. And the other side of it is when we compensate, your body lays down fibers in all sorts of ways to allow for those compensations to happen so that we can survive, so that we can
mm,
keep moving in some or other way. But when that
yeah.
happens for long enough, it becomes fixed. And then it becomes a limitation. And it's easy for your body to keep using that compensation pattern. But when we go and remove those limitations and do it in sequence, there's a reason why we do it in that sequence because
Yeah.
that's the sequence the body needs.
Mm,
Then your brain has got the amazing ability of restoring. Those
mm,
neural pathways to the correct structures are there. The electric cord is there. We've just stopped
mm,
using that one. We've used another
yeah.
one for a while. And as soon
Mm,
as your brain recognizes this pathway is available again because the limitations are gone, it adjusts. We don't have to tell it to do it. It just does it because your brain knows this is the more efficient way of doing things. And that's
mm,
always for me the beauty and almost the confirmation of the work we do. When we do the right stuff, the body responds immediately and it
mm.
immediately improves and immediately changes the flexibility or the strength when we remove the right restrictions. And that's really where the magic lies. It's
Yeah.
and it happens
And,
in
and
what
the
is it?
thing of actually doing the before and after, so we'll either do a range of movement test
Yeah,
or we'll do a strength test, active resisted,
yeah,
um, and then we do the correction and then retest it in the brain because you can see on people's faces that sometimes they think it's going to hold and there's nothing, and then once you do the correction and then you test
yeah.
and it's strong, they're surprised. And then when they get up and use their body, walking or whatever test you're using with them, the brain then goes, I can use this now.
Yeah. And the reason why the before and after tests are so important is we use it to show the client because it is weird. It's weird to, it's not foreign things for us to rub in certain areas and suddenly we're stronger. How is that even possible? It's hard for people to wrap their heads around it. And it's important to then provide the explanation after. But it's important for them to feel it. Firstly,
Yeah.
to see why it is that you're doing something different as an osteopath for them. Why is it if they can feel the difference, then they're on board. If we talk about athletes and honestly for anyone, if they feel the improvement, they don't care if you're doing osteopathy with them or physiotherapy or activations or magic for that point. Our clients come to us to help. They're asking for help with solving a problem. And whatever
Yes.
their problem is, we need to use the best tools that we have available to solve their problem. And if that is not pure osteopathy and it's not pure physiotherapy, then I really don't care. It's our in fact responsibility to use the best technique we have to help them. And
Mm.
I've very seldom come across clients that object to that.
No.
Once you show them, they don't say, oh, no, no, no. I want you to rather do this other thing that works less. Rather do
Yes.
that. They
No.
never do. Therapists get their head stuck there. But when you show a client and they immediately feel the difference, they're like, yeah, do that stuff. And that's almost always the case, which is why something we mentioned earlier, we just have to show them. And
Yeah.
then they're generally on board, regardless if it's osteopathy or
Mm.
activations or whatever it is you're doing in the end. If they can feel the difference, then we are solving their problem and then they're happy for us to do whatever we need to do.
Mm. So it's the same as we were saying earlier with doing the activation, and some of the practitioners say, "Oh, you just have to keep following the sequence," and it's like, well, no, you apply what the body needs. One of the principles of osteopathy, I've got it written down through here, was the treatment must be focused on the patient, not the disease or the condition.
Yeah.
So when you treat them and they come in with a shoulder pain or knee pain, whatever it is, they don't, like you say, they don't really care what you do other than that they feel better. So as a practitioner, when you go through the sequence and you see such a big change, it's hard then to just go back to things that were maybe 40% success or less, because you can see that the change that changes within that patient. So again, it sells itself to the practitioner as well as to the patient. And
Yeah.
again, it's patient centered, not doctor centered. Just because we learn to manipulate doesn't mean we manipulate everything.
Yeah. And just because someone has a certain condition, it doesn't mean we always follow the same treatment protocol that we were taught to do. We need to see how they respond. We need to, and this work is all about seeing how the body responds, seeing how the body responds and allowing someone to feel the changes. And in my experience, when I worked as a conventional physiotherapist in the initial years of my career, I always felt people can keep coming back with the same problems. We keep seeing that same guy's back a month later. "Ah, God, how are you? I'm okay. The headaches are back. And we were taught that's normal. We were taught, well, this is great. I'm actually helping him survive his monthly headache. And I say this with respect because this is how we were trained. And I'm not saying this doesn't help clients. But for me, the penny dropped with this work. But when I started changing, when I started testing them, and let's just use the example of a headache, and every time we see with these chronic headache clients, they have upper body patterns, jaw, neck, shoulder patterns.
Mhm.
It makes sense. This is why they're getting the headaches. And when we start changing those patterns, suddenly we can give more solutions to clients, not just temporary relief. We can provide and give them tools to actually learn to manage their headaches so that they don't have them anymore or have them much less. Now, I'm not saying there's a solution to all problems and there's a cure for every single thing out there, but there's definitely a lot more solutions than what I was taught as a physiotherapist. But in order to get more solutions, we need to be willing to move out of our rigidity, maybe do something that's slightly different from just what we were trained. And I
Mm.
I always encourage people, you don't have to take my word for it. You don't have to take Andy's word for it. But you do have to try this work and then tell me your experience. And I'm happy to then go with that. But often
Mm.
therapists stops right there. No, no, but this is not what we were taught. Therefore, we're not going to do this. Well, there's many, many things about the body that we don't understand yet, and it doesn't mean it doesn't work. We just don't get
Mm.
it, and
Yeah.
therefore it's not taught at university yet. But and this is definitely falls in that realm,
Mm. Even with work around fascia, it's still not really heavily taught in universities. They're still
right?
talking muscles, tendons, ligaments.
And it's because we don't understand it. Now, it doesn't mean we don't have measures for it. And medicine at the moment, if we don't have an actual measure for each thing, we say it doesn't exist. Now, that's
Mm.
not quite true. It doesn't mean it doesn't exist. We just don't have a measure for it, right? And
Mm.
there's unfortunately a lot of things like that in the body. And if we wait for everything to have a full understanding and measure, then I think we're missing out on a huge opportunity to make a difference. And with time, I've got no doubt that we already have measures as we teach on the workshops. You can constantly see how this is very measurably changing things in the body. Do we
Mm.
understand all of it? No, not yet. But it's because our body is just so fascinating and complex. Will we have more of the answers in the future? I have no doubt. And I'm looking forward to to learning more, and which is why this work keeps developing, because there's always more to be added and more value as we understand and discover more of what we're doing.
Mm.
Andy, let's maybe wrap it up with what would you say to a osteopath listening to this podcast and any other therapist for that matter, but maybe from your experience, why should they consider doing this workshop? And what do you think the value is that they'll get out of attending a fundamentals workshop for the first time?
Yeah, I think that they need to see it. They need to feel it and feel the difference. Too much of the in most of the professions, it's become too I wouldn't say too structured, but too much based on this evidence-based medicine. One of the things Doug used to say was, "What if everything you was taught was wrong?" And it's actually just going in with that open view that maybe there's something different that I wasn't taught. Definitely as I've gone through, I've been nearly 30 years practicing. A lot of things promise things, but they deliver very, very little. But this is definitely one of those things that you can't just watch and listen. It's something that you really need to experience, but going in with an open mind, rather than this thing of no, 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 this can't be, because we've got our logical mind, then we've got our emotional mind, and we need to feel the changes, not just logically think this is this is this. Like I was very much a structural osteopath, and I still treat very structurally, but I now understand the real integration of the fascial system and the nervous system. But I'm not just cracking joints, not just manipulating joints. A lot of, I'd say a lot of osteopaths. There are some osteopaths out there that are just happy to teach, keep cracking joints, um, but with no real change. The idea of the manipulation is it's part of a treatment process to create change within that patient. So this is another way for them to reintegrate it. I mean, I probably work slightly different to you because I do the same activation release, fascial releases, but I also still do joint manipulation. But I'm not just doing joint manipulation. So we all treat and use, but using B activated principles, the principle of the breath and moving. And then once you take that on board, you can then go, okay, where else can I take this? It's not about going to do a dry needling course and then just put a couple of needles in and then go and rub somewhere else and manipulate something else. It's about treating the whole person rather than having techniques to use on patients' tissues. So I think definitely once you understand the concepts and the principles of Be Activated, you can see how you can envelop it into your practice and how you can sort of move forward with it.
And it it doesn't necessarily mean we throw away everything else we've learned, like you mentioned. It's about adding something else in. But when we add that in from the start, it makes all, if you're going to be doing some joint manipulations, you might find that it's a lot more successful if you've added these principles in before. Or you might find on some occasions, once you've done the activations, you get to and the joint manipulation isn't needed anymore. And
Yeah.
for me, that was a big thing. When I started doing activations more and more, I would eventually get to the symptomatic area. Let's just use the example of the headache again. But by the time we get there, there's not that much to do in the neck anymore because the
Mm.
body's actually let go of that tension because we've corrected the cause of it earlier. And if I still then needed to do something locally, by all means, then we do. And sometimes we
Mm.
do, but we still need to bring in that cause of it earlier. And if we do that, our success rate and the longevity of the results is just so much better. But it doesn't
Mm.
take away from all our other skills. In fact,
No.
it improves the other things. It improves our exercise. It improves the rehab, and it allows for us just to shift the level of the results that we get. I think that's for me what I took out of it early in my career when I eventually decided, well, I need to do this with every client.
Mm.
Andy, that was great. Thank you for sharing your insights and knowledge and experience with the work. Thank you for what you do for the world of Be Activated up there on the Gold Coast. It's always lovely chatting to you. For those of you that have listened and this has created a little bit of interest, I hope it makes you wonder, if nothing else, what is this weird stuff we might be doing? Then please reach out. I'm happy to have a chat to any of you. Find me on social media, send me an email. And if you're really interested, make sure you get onto our fundamentals workshop. That is their starting point. This is where your journey starts with this work. This is where you learn what it's all about and then decide how you're going to use this in your world. Then decide if you have value. And after that workshop, I'm very happy for you to make that call. But don't make that call if you don't know what we're teaching, because what I can assure you is that this work is unlike anything else you've learned before. This is not just another myofascial workshop. This is not just another bodywork workshop. This is different from anything you've experienced and seen before in all likelihood. So make sure you experience it. See it for yourself, feel it in your own body, and then see where does this fit into your world. I'm looking forward to meeting you all there. Andy, you must have an amazing day up there on the Gold Coast. And guys, we'll catch up soon for another podcast in the next few months. All the best. Take care. Bye bye.